Okay, I'm going to get us started and we'll move forward with that. If you would like to turn your camera on, that would be great. I think we'll still have a few more people joining us, but it is a smaller group today, so we will be able to have time for questions and conversation after the presentation, which is always really helpful. Sometimes these smaller groups are really, really great for really in-depth conversation. So get a few more people coming in. Let's let them in. Okay. Great. So I appreciate everybody being right on time. Actually, quite a few of you were extra early too. So that's always nice. We can get started and leave time for all of our conversation at the end. So I really appreciate that. And if you have coworkers or staff members who are not with us today, they weren't able to make it, we are recording the webinar and we plan to put it on the blog once it's processed and ready to go. So you could share it with your staff. It's a really important topic, and we hope everybody will have a chance to watch the webinar at some point so that they can get this information. So we have two speakers with us today who have a lot of extensive knowledge in this area. So we're really excited to share that with everybody. Let me let a few more people in here. And then just so everybody, I know we've all been doing Zoom for a long time now. We're pretty well versed in it, but just try to stay muted while you're not talking. You can obviously feel free to mute if you have questions, or as we're going through the webinar, if you have specific questions, you can also put those in the chat and I can bring them up at the end or whenever we have time to address them. But if you're not speaking, if you could stay muted just for background noise. We all have like kids and dogs and fans and things going on in our homes right now. So it can tend to be a bit of a distraction. And then if you forget, I also will mute you myself. I can do that. Just don't take it personally. It's just so that we can hear our speakers better. So I will introduce our speakers and I'll let them just get going right away so that we have time for all of our conversation. So like I said, we have two speakers with us and we're incredibly lucky to have double the speakers today. So our first speaker is Aizita Magaña, and she is the Director of Planning and Public Partnerships for the Vaccine Preventable Disease Control Program at LA County Department of Public Health. And Aizita has over 20 years of public health related experience, and as part of the response to COVID-19, she has been supporting community engagement and promoting vaccine confidence. And then our other speaker is Dr. Franklin Pratt, and he's the medical director of the Vaccine Preventable Disease Control Program. And as the medical director, Dr. Pratt is responsible for all clinical aspects of the program. And he is currently part of the public health response to COVID-19 with an emphasis on helping develop the strategic alignment to support mass vaccination. So together, both of our speakers have extensive knowledge and expertise about the COVID-19 vaccine and how to promote acceptance of the vaccine in the community. So we're so lucky to have them here. So thankful that they were able to join us and give us this time today. So please join me in welcoming Aizita Magaña and Dr. Pratt as they present today's webinar, Improving Vaccine Confidence and Acceptance, How to Talk About the COVID-19 Vaccine.
Thanks very much for the introductions, Martha. I'm going to go to share screen now and pull up the slide deck. How's that looking?
Looks great. Thank you.
Okay. Let's once again, thanks for the invitation, and we're glad that everyone on this Zoom meeting was able to join us. And we hope the next hour and a half or so will be informative, and you'll consider it a good use of your time and the energy to make it work. I'm going to talk about kind of a broad range of things today because we want to address the COVID-19 situation and the vaccine from your perspective as adults who are engaged in all the activities of life, and also as representatives of your clients and their families. And you kind of take on this dual role, you know, like you're advocates, you're keeping everybody supported, and you work in unique situations with unique clients. And so we want to try and cover as best we can all the things that might be relevant to you right now. And if there's anything we overlook or any question you have related to our public health initiatives or what we're talking about, please put them in the chat or let us know. We are happy to handle any questions you might have or get them to people who can give you the expert's answer. So just a brief update on what's going on with COVID-19 in LA County right now. An important topic that hasn't hit the radar screen fully yet, but that's so many of our youth, so many of our children missed vaccines during the pandemic for several very excellent reasons. But we still want to get them up to speed and get them protected and get them back into school or get them back into whatever their thing is, whether it's daycare, school, just to get them going back to a life that they once knew as best we can. I'll give you the schedule just so you know what it looks like and how to get it. We'll talk a little bit about vaccines, pregnancy, lactation, and fertility, which are questions that come up commonly. Here's the current state of vaccinations in LA County as of just a couple of days ago. So 10 million, over 10 million doses administered, and a significant percent of the population immunized, but we still have work to do. One dose and only 67% is great, but we want to bump that up to 2 doses and 80 to 85% as soon as we can. So that's kind of our end game, but just to give you the overview there. This kind of graphically displays where vaccine uptake is occurring in the County of Los Angeles. This particular graphic shows all ages from 16 and older. And the darker the green, the higher the uptake. This is usually by census tract or by city or community. So we're doing pretty well, actually. Some pretty good coverage across the board, except for a few areas in the Antelope Valley. But let's go to the 16 and 17-year-olds who might be closer to some of your clients. And you see we have more gaps. Now that represents a newer vaccine for this age group. And depending on who you talk to, they're really enthusiastic. I've seen that when I've worked with my pods, and some of them are just taking a wait and see attitude. So again, a little work to do here. This slide clearly demonstrates the disparities and the lack of equity in access to vaccines and uptake of vaccines. And we can go through this slide. There's a lot of detail. What I try to emphasize to folks is this slide represents poverty and communities of color. And we've got to take that head on and figure out how to resolve those inequities and even the playing field, if you will. By the way, the slides will be available to you when we're all done, so you can come back and review the numbers in detail as you wish. So this is an interesting slide. It shows the cumulative cases and deaths in the County of Los Angeles since pretty much the beginning of the pandemic. And what I'm happy about is the steep curve, the high curve. You see how it plateaus. So we hit 13, 14% almost around New Year, and we've pretty much flattened out. And also the cumulative death rate is also flattened out at that 2% mark. It's not going up. So we've plateaued, which is awesome. But we want to maintain that, particularly as we see variants coming up, which I know you've heard about and which we'll talk about. This is just to show you rates of deaths and cases throughout LA County. The deaths are on the left side and the cases are on the right side. And we see again where we have communities of color and more poverty, we see more cases and more deaths. I'm not trying to oversimplify this, but I'm not trying to confuse it with a bunch of facts and factoids and discussion that doesn't add to the mission here, which is to get these communities and the people who live in them on the level playing field with access to vaccines and healthcare. So just so you see, you know the areas, you all know these maps, you work in them, you get around, right? You know what's going on. This is kind of the age distribution. and it's not unexpected. As we get older, we get more susceptible. The highlight is, as older people have become immunized, we've seen the case counts go up in younger people. The virus is smart. The virus wants to live. The virus wants to reproduce. Basics of biology. So it looks for a person who is susceptible, who doesn't have protection. So these curves are starting to shift into younger age groups. So we just cannot lose sight of that. So let's talk about how these younger age groups appear when they are infected with the SARS-CoV-2 virus. Good news. Most children do well with mild disease, get better in a couple of weeks. The incubation period, or the amount of time it takes to show the infection after you're exposed, can range from 2 to 14 days. That's kind of a long incubation period. So you can't really predict when someone might get sick after an exposure. It could be 2 weeks out. So we always have to keep that in mind, that this virus is smart, it is tricky, and every time we think we know about it, it proves us wrong, or it educates us and humbles us. This is important for you, and I want you to focus on those. I believe most of your clients are in that 5 years to younger cohort. If I'm wrong on that, please correct me, but that's my working assumption right now. And of course, the little babies can't tell us that they've lost taste or smell. So we have to look for other things. And as you can see, the big ones there are fever and cough. And notice where it says gastrointestinal symptoms: nausea, vomiting, diarrhea. Of course, babies don't tell us that they feel nauseous, but they definitely tell us they can throw up and they have diarrhea. Please focus on those. The cough are pretty common. We're all used to that. You deal with that every day in your worlds. But the vomiting and diarrhea symptoms take on a new importance, particularly in the little babies, our preschoolers, and toddlers and infants, because when you look at what defines how ill the baby is, the big discriminator, the big separation is in those symptoms. That the blue, those are the kids that go home or stay at home. The red, those are the children who need to go to the hospital. And notice how there's a lot of similarities except for that nausea, vomiting, diarrhea, abdominal pain, all in the tummy, right? So just kind of tuck that away in the back of your head. If you see a youngster who might be ill and there's more of those symptoms pronounced, that's definitely a little more worrisome. And we need to ensure that they're taken care of medically. Let's go into the vaccines now. 3 currently in the United States. We now have millions of doses administered nationwide, and those doses confirm what we found in the initial clinical trials that led to the approvals. The clinical trials, and certainly what we see now, covers the full spectrum of the American population, from ages 16 and older to every other possible combination of humanity in our country. Millions of doses. And a couple things we'll talk about, but essentially the safety record is exceptionally good. We just aren't seeing surprises, except for 2, which we'll talk about, because we need to make you aware of those. So it's an incredible track record, and I think it speaks well for what was done and how it was done, and we'll talk a little bit about that. A lot of people think these vaccines were developed super fast. And what I want to do is reassure you that what we know about and what was talked about prominently was a shorter period of time. But what is not talked about is that 20 years of work by doctors and scientists and labs on the vaccine platforms and on the coronavirus led up to what we did in 2020. So we had a huge kind of jumpstart, if you will, for 20 years before we actually had to focus on these specific vaccines for this specific virus. And the steps that counted in clinical trials, no shortages, no skipping. It was done exactly the right way with the full analysis and the full length of time. So when someone says to you, well, I'm a little worried because I think they were made too fast, please remind them parts of it appeared to be fast, but those were usual ways we research vaccines, but there's a 20-year history that got us going that we could pull off the shelf and apply to the current situation. Just a brief overview, the 3 vaccines. I think that the trend here that's important for you as you work in the field is that with time, we're seeing how these vaccines can be stored and transported at warmer temperatures. So you heard before, I need the ultra low cold, super special freezer. That necessity doesn't exist the way it did 6 months ago. We can now take the vaccines and put them in a normal freezer temperature and keep them at a normal refrigerator temperature for much longer now. So that's a game changer, because that means we can move these vaccines to faraway places, walk around more. We don't have to be tied to this special freezer that's not a common commodity that most of us ever even knew about before this. 2 doses for the mRNA vaccines, 1 dose vaccine. Okay. The only people who should not be given the vaccine are those with a severe allergic reaction to any of the vaccine components, which is a very small number of people, and an allergy to polyethylene glycol, which is a chemical compound in some substances and medicines. And they mentioned this polysorbate thing. It's just another chemical that's out there in some products, and there's a cross reactivity. But people who have these allergies are usually very aware of it, and we screen for it. The other thing is, if someone has an immediate allergic reaction to a vaccine or an injectable medication within 4 hours, and this is significant, trouble breathing, throat swelling, lots of hives on the skin, then they shouldn't receive the vaccine. But the common allergies, pets, food, hay fever, pollen, no problem. The vaccines are safe to give for people with those allergies. From a public health point of view, we don't want to give the vaccine until someone has finished their quarantine period if they've been exposed to known COVID. And that's that 14-day thing we talked about at the beginning. You want to complete the 14 days before you immunize them. There's some special considerations for TB testing. Just be aware that they exist. Leave the details to nurses, doctors, the clinics, but just know if it comes up somewhere that someone had the vaccine and they need a TB test, it's okay to say, wait a minute, let's just double check the timing on this to make sure we're good. The other thing that's new and very good is we want to co-vaccinate. It's okay now to give 1, 2, or 3 vaccines at the same time. We held off on that till we knew more stuff. Now we're good to go on that. We feel comfortable with that. And the details are there about an inch apart and stuff like that. But just know that it's okay to go to a doctor's visit and get 3 vaccines on the same day at the same time. So let's get into some of the additional kind of clinical things that come out of these 3 vaccines. The first one is the variants, which I know you've heard a ton about. So variants represent mutation changes that are the natural process of reproduction or replication of a virus. It's like if I give somebody an audio file of a speech, and I give 10 people that audio file and say, write down the words as you hear them. Guarantee you will have 10 different versions of the audio file, because that's just human nature. We interpret things a little bit differently. We spell it a little bit differently. It won't be a perfect copy of the tape. Well, that's what the viruses do. When they do the copy process, there's a little goof up. That's called a mutation. Some mutations make the virus more infectious, more dangerous, allow them to sneak around our immune system. Maybe the vaccines don't work as good. Other mutations lead to the death of the virus, because again, it's randomness, right? And sometimes it's like there's an oops mutation from the virus point of view. It's like, oh, well, I can't infect anybody with this particular mutation, so I'm a goner. So you see that happens all the time. This is what the spike protein looks like. I show this just because most of us have heard the spike protein words, and the colors are cool. And the letters and the numbers represent the mutations. So these are like very small changes that change the structure of the virus and change its ability to do its job. So that's just what it looks like, little background. So here are the mutations we're kind of worried about now. And I'm gonna go right to the bottom where it says Delta. What's important is what's in the salmon colored boxes there, where we have increased transmissibility and we think there's an increase in hospitalization. So right now, this variant of concern is of the highest concern, because it is in the United States. As you know, it's around the world, and it hit the East Coast kind of first, and it's coming west. And we're seeing cases go up significantly in the Western states and in California, and also in LA County. So it's here, it's really growing in its effect, and we do need to be concerned about it. But the good news is the current vaccines work well against it. So we have this variant that's clearly on the move, particularly if you're unvaccinated, but we know the vaccines that people have been given are very effective against it. And you might have heard of that story from Florida, where 6 people in an office were exposed to COVID. 5 of them got sick. 2 of those 5 sadly passed away. And the one person who didn't get sick was the only vaccinated person in the office. So, I don't know really what to make of that, except what I've just told you. But I think it speaks to what we've been talking about in terms of the vaccine working and being safe. And this is just to give you a highlight of what's going on in the United States. You can see right down here is the Delta variant, the one I'm kind of circling there, that darker orange. And you can see how that didn't even hit the radar screen until recently. And now it's taken off in the Americas. So that shows you how quickly it's growing in the population. So what's the summary for variants? They're normal. For a virus, they're normal. Thousands exist and have existed. More will happen, guaranteed. Some lead to a dead-end deal for the virus, and others make the virus survive better and stronger, more transmissible and more dangerous. The keys to defeating the variants. These are the money items. These are the deal breakers for this virus. Is you're protected with a vaccination and non-pharmaceutical interventions, which is a complex way of saying cover your face, wash your hands, cover your cough, stay away from crowded places when you don't know the vaccine status of the folks you're with. Now, if you're with people who you've been with a lot for a long time, everybody's vaccinated, everybody's cool, it's different. But just these non-pharmaceutical things really work. The other thing we've seen with the NPIs, non-pharmaceutical interventions, is we had no influenza. last season. There was no flu. We think that's because of all the stuff we were doing for COVID, also protected against the flu. Let's talk about the pediatric issues in the vaccine. So you have one vaccine now, the Pfizer vaccine for those who are 12 and older. The two other vaccines are for those who are 18 and older, but Moderna has put in the paperwork to get approval for 12 and older. That should be happening really soon. And as more vaccines are developed and more work is done, we anticipate requests for younger kids, specifically Pfizer requesting to go down to like age 5, maybe by the fall. So that covers a lot of kids going to school. So all the medical, social, growth, intellectual benefits, learning benefits, happy kid benefits of being able to go to school, we might be able to have those start in the fall if everything goes okay on this. The other thing is we need our children, we need our neighbors' children to be immunized to protect all of us. That's the community immunity concept. So we're all in this together. But I think particularly you all, because you know how everything links in a community. It might just be like with a child who's under 5, but in fact, all the dots connect and you see that at your work. Same thing for vaccinations. And believe me, a lot of people are trying to do the research on this. So more to follow, exciting times, it will happen. Safety. These are the side effects for the 12 through 15-year-olds. This is right from the paper that went to the federal government for the approval process. So what it basically, it details well that the big thing you have to worry about right here is the injection site pain. Where the needle actually went in, it hurts for a day or two after you get it, then it goes away in a day or two. And that's kind of across the board. The other side effects are substantially less. And these are the side effects that are more for the whole body in terms of fever, feeling tired, having a headache. Headache was a big symptom in our kids, but for some reason also in people who didn't get the vaccine. But these will happen. They're expected, they're natural. They tell me the immune system is working. They come on in a day or two, they go away in a day or two. That's key. And now that we've given millions of doses, all this information has been further supported and locked it in as the reality. So in summary, we have over 3 million doses given. We've had 2 what are called safety signals, which mean you have a significant complication that is probably an outlier. The first one were the blood clots you all heard about from the Janssen vaccine that caused it to be stopped for about, excuse me, I'm getting like 1 million spam calls the last 24 hours. Can't even explain that. If anybody has a solution, please let me know. So we had the thing with the clots and the Janssen, which you know about. So now it's back being used, but people know, here's the risk, right? Here's what you got to think about. The other thing is the heart inflammation in basically teenage boys, the myocarditis situation with the mRNA vaccines. That's being discussed today by the CDC. Their meeting is going to end in about a half an hour, and they discussed that today. So on tonight's news, you're going to hear something about what they think. It looks like there might be a link, but it's super rare. Of the millions of adolescents who are immunized, right now, last number I heard was under 500 cases, but we'll wait and see what they say. So that might be another thing we got to be sensitive to. Fortunately, pregnancy and infant outcomes are great. And we know that COVID during pregnancy is not good. Pregnant women who get COVID have a significant number of medical complications and more death than pregnant women who don't get COVID. So That's an ongoing project, and that's what the bottom line represents, continuous monitoring, but I do have some data to share in a minute. This is important because you'll see in the middle of this graph and the next one, where when you look around week beginning March, 3/1 to like 4/12, right? Notice how the red bars drop substantially. What that tells us is children missed their vaccine appointments because of COVID, because of the shutdown, because of isolation. So when we reopened, you see how it goes up. That's in the under 2-year-olds, right? Who scare us the most. But look what happened in the kids aged 2 to 6. Their immunization rates dropped. So where you, as ambassadors in the field, you're now kind of like public health ambassadors in addition to everything else you do, you can be an advocate for that child. And just to remind the family, the parents, the caretaker, is the baby up to date on their vaccines? Simple question. And I assure you, many of them won't be. So it's just a gentle reminder to the family or the parents, caretaker, to have the baby's vaccines brought up to date. And there's a whole way to do that. This is the numbers that drive that request. And this is what tells us what they need and how to do it. Please don't try to memorize this. Know that it exists. Know if someone asks you for it, you can say, it's complex. It's can be kind of hard to get into it sometimes. It took me time, but let me get you a copy of it. It's on the web, and we can make sure those links are available. But just know that it exists. It's called the immunization schedule. Those are the two key words, immunization schedule. And those are, if you will, that's the essence of what we're talking about here. It's all right here. So please be that child's advocate and just ask a question. And it's just a reminder and to give people comfort, because more and more doctors' offices are opening up, the clinics are opening up, and they're taking all the right precautions to safely administer vaccines now. We've learned a lot in the last year and a half, and we're applying it well and consistently. Another job I have is to go out to the clinics and visit with them and see if they have questions, make sure they're comfortable with what they need to do, and to help them. If there's a little something that's a little sketchy or they want more clarity, then we talk about it and we go over it. Sometimes we even practice it. So that I'm comfortable that the community is safe when they go to get their immunizations. Here's the more complex schedule, and it gets into everything. And it gets into more of the details of why children need certain vaccines at a certain stage of their life based on age or because of certain medical conditions. Again, it's a reference document. Just be aware that if someone asks you a question related to, well, my children have these medical problems, what vaccines do they need that might be special? It's totally okay to say, let me get you the material that will help answer that question. I always refer to these. I find that with the information overload we all have, trying to remember everything, don't do it. It's not worth it. I can just pull it off the web or out of my pocket in 5 minutes. Same thing here. This is if children have pre-existing medical problems, there's a whole new formula for their vaccines. Just know that on the immunization schedule for children and adolescents, all the details are there, and you can easily connect people with the documents or get them yourself so you can help them. But just know about them. They're incredibly useful, and once you've used them a couple of times, they're actually safe and easy and actually fun to use. Couple little changes that you won't have to worry about, but if someone asks you about, is every dose necessary for every child, for everything, say most, yes, but there's some exceptions, and I'll get you the information on that, and it's all on the schedule. As that child's advocate, I need you to if someone is receptive when you say, hey, let's make sure the vaccines are up to date, but they need a little help figuring it out, they might need you to help them go over the vaccine records for that child. And they might ask you, well, where do I go to get the vaccine? So it can be a doctor's office, one of our clinics, public health clinic, many community clinics. We have lots of resources now for vaccines in LA County. And the only other thing we really encourage you to support is putting immunization records into the California Immunization Registry. That way, in a few years, particularly when that child starts school, and we have to verify their immunizations for school admission, there'll be a good record for it. The issue of pregnancy vaccine safety. This is a big study, came out less than a week ago, well, actually almost a week ago. And we'll give you the summary statements, and they're right here. Basically, there were no safety issues identified that could be related to the vaccines. The complications of pregnancy that occurred before COVID was around and before these vaccines were administered occurred in the same number after people were vaccinated. Women would get the vaccine, there was no change. That's what's key. And they'll continue to follow this. This project is going to go on for years, but this is a huge study done very well. That's very reassuring. And this is just to show you the side effects. That's a common thing, okay? Notice that the side effects are really the same whether you're pregnant or not pregnant, or you did or didn't get the vaccine. The curves overlap beautifully. So that's what we want to see, that pregnancy is not a special risk related to the vaccine. That's the important message. And the details, if you want more and more and more, call Aizita, call me. We can get you all you need. But the key concept is there. It's safe, it looks good, no difference. Here is the study that talks about, do the vaccines work? And do we see the vaccines in lactating women? So women have asked, well, I'm breastfeeding my baby. Is the vaccine dangerous? No. Does the vaccine get into the baby? It looks like it does. We don't know what the benefit to the baby is quite yet. People are looking at that, but we know that breast milk contains the protection. It contains the antibodies. So that's good. And also, when the baby is before birth, the blood carries the antibodies from the mom to the baby through the placenta. And that's what this really nice, beautiful study just highlights. These are the additional benefits of vaccination in pregnant women and in women who elect to breastfeed. So just a brief kind of wrap up here. We've talked about what's going on in LA County with COVID-19. We've highlighted the Delta variant and the role of vaccination and non-pharmaceutical interventions. I hope I've reminded you well enough to be an advocate for your clients, for children who need to get all of their other childhood vaccines brought up to the acceptable levels of protection. You know about the Pediatric Immunization schedule, keywords, immunization schedule, and we'll help you, we'll give you links to it so you can access it right away for either professional or personal use. Then we've talked about vaccines and pregnancy, how based on everything we've seen, which is pretty substantial now, we know that they're safe and they provide protection. So they're effective. And I think, just want to say thank you for your attention and your interest. And when Aizita's done, we'll take some questions. And I really appreciate the work you do and respect what you do. I've spent a lot of time in the field myself, in different components of my professional life. And I appreciate how difficult it is. And you have your moments out there when you're in the field and in the home that can't be explained to people who haven't been there. So thanks for everything that you're doing. Much appreciated.
Okay, thank you, Dr. Pratt. I'm going to go ahead and try to share my screen here. I think you, okay. Can everyone see that? Thumbs up. Okay, thank you. Hi, good afternoon, everyone. My name is Aizita Magaña. I work for the Vaccine Preventable Disease Control Program, and I'm so pleased to be here with you today. Thanks, Dr. Pratt, for giving us all that great information. So much information coming out all the time about the vaccines. And what I want to just say out of the shoot here is that it's not important that you become vaccination efforts. What's important is that you are someone people can go to and feel comfortable with asking questions, that you're patient, that you listen, that you're a resource for them. So it's just not realistic that we're all going to stay up to date with all that's going on. It's just too much. But you can be aware of some of the key issues. And we're going to talk about having key talking points and just the overall approach. I also know that because of the work you do, being home visitors, this is something you do with all of your work. You know how to communicate with people, you know how to do active listening, and so this will be nothing new for you. I was sharing with Martha that I just really consider the work that home visitors do like gold. The relationships you have with your clients can't be replicated. We had all of this mass availability of vaccines at these big pod sites that you know about, maybe got your vaccine there yourself. But there were a lot of people who were waiting and seeing. So now we really are relying on the relationships and the communication and the conversations that you're having with your clients for those who are waiting and are still afraid or have questions. So we're looking for you to do that. I also shared with Martha that I'm proud that I started working at First Five, and I think right when they started, and this was my first grant was to fund home visitation. It's something that I believe in so much, and grateful again for all your work. So today we're going to talk a little bit about a review. Dr. Pratt gave you incredible background. So we're just going to do a quick review, a little bit about the rates. He shared that with you too. And then we're going to talk about confidence and some of the issues, the approaches, and how we want to talk with people when we talk about vaccines. So I'm going to review some of these talking points, and these are things you already know. This is sort of like a distillation of what Dr. Pratt already shared with you. But the most important thing when you talk about people, when you talk about the vaccines with people, you've got to put the information in your own words. It's got to make sense to you, so it makes sense to other people. I don't think people want to know so much about science, but they want to hear about the vaccine in your authentic voice and the words that make sense to you. So to have a basic understanding, I call them talking points, so that they're things you have in your pocket. So when people have questions, they're just key phrases that you can share with people. So responses to why someone should get vaccinated. These are things you've all heard, needing to protect ourselves and our communities. We need to make sure that our family and friends don't get infected, and we're not infecting our aging parents. Social distancing and masks aren't enough to stop the pandemic. We need a vaccine. It's our most critical tool. Dr. Pratt knows this too, and he's been there, you know, during the surge, when we had 7,000 people in the hospital, when we had a death every 6 to 10 minutes. A lot of those people who died in those communities that were impacted are some of the same people who are choosing not to get immunized. And that's really painful to see and know. And so the burden is on us to share the information, to share our own experiences, and give support and information, emotional support and information to people who are still trying to make a decision. Let's see if I can, oops. People are also going to ask you if the vaccine is safe. And so again, these are things that have all been discussed, but putting them in your own words and having quick descriptions of why the vaccine is safe is important. One that I'd like to emphasize is that many people of color participated in the vaccine trials. Millions and millions of people in the US have already been vaccinated safely. I think we're at like 350 million people have received the vaccine. We have systems that are watching for any serious events. And that of course, it's much safer to get vaccinated against COVID than it is to get sick with it. I was reading just yesterday that we're finding some of the long-term effects of being sick with COVID-19 include brain damage, potential strokes, and so even for people who weren't severely sick. So we are finding out more and more about the long-term effects of having been sick with COVID. The research that we have available for the long-term effects of the vaccine are not available because we just started vaccinating people last March. But we do have plenty of information about what COVID will do to you and also what COVID can do to you long-term. And also there's this idea that we cut corners, that the vaccine was made too quickly, and that's why it's not safe. It's a lot of information, but I'd like to share this slide to show that work on the mRNA technology for vaccines began in the 1990s. And so why we were able to have these vaccines so quickly was due to the fact, number one, that work on them had been happening for decades. And then the pandemic happened, so we were able to pour in, the government, a lot of resources, both scientists and money, to finish the development and then produce the vaccine much more quickly than we are able to do with other vaccines in the past. So this is a lot of information. I also like to show too that Dr. Kizmika Corbett in 2014, African-American, also was really key to contributed a lot of key work to the mRNA vaccine technology. Do the vaccines work? Yes. We were all surprised and amazed at how effective they are. Maybe all of you are too young, but on the Oprah Winfrey show, she used to do this thing where she gave a car away and she used to yell, "You're going to get a car and you're going to get a car." And when I go to these vaccination clinics and I see people getting vaccinated, I'm like, you're not going to die and you're not going to die and you're not going to go to the hospital. No vaccine is 100%, which is why we rely on everyone to get vaccinated. But the COVID vaccine will protect you from getting severely sick, being hospitalized, and dying, which is pretty amazing. Again, that they are safe for both children and adults. We know that the immunity, the protection that builds up takes 2 weeks after your second dose, or 2 weeks after your first dose if you got Johnson & Johnson. That we do see children getting sick with COVID, and we've had deaths and hospitalizations. Children are at risk. And we do need to encourage parents to vaccinate their children if they're eligible, and that they would have the similar side effects that adults get. And then this idea of fertility has been circulating widely, and there is absolutely no evidence that the vaccines impact a person's ability to get pregnant or impact her pregnancy, as Dr. Pratt shared. Again, what is fully vaccinated? We have to remind each other that it's 2 weeks after your second dose where you're fully vaccinated, or 2 weeks after your first dose of Johnson & Johnson. I, like many of you, am celebrating the opening of Los Angeles County. I've seen my parents, I've seen friends, I've gone out to dinner. I'm fully vaccinated, but the pandemic is not over. And there are plenty of risks for people who are yet not vaccinated. And that includes people who can't yet get vaccinated, including younger children. So we have about half of the population in the US who's gotten a dose. We've got 26% of people ages 50 to 64, but only 13% of the 18 to 24-year-olds. So we have a lot of work to do in this population. Only 10% of the world is fully vaccinated. That's not huge. We heard from Dr. Pratt about this variant. So the good news is, of course, that if you're vaccinated, you have protection against a variant like the Delta variant. But if you're not, you're even more at risk now because no one's wearing a mask, no one's social distancing. So if you're not vaccinated, your risk is higher right now of being infected. And the more people who get sick with COVID, the more opportunities the virus has to mutate and create mutations, variants. So for that reason too, we want people to get vaccinated to stop the chain of mutations that occur when a lot of people are getting sick with COVID. And then, the good news is, this was, I want to say yesterday, we just had 5 deaths. And I say that with an upbeat tone in my voice because we had so many people die in December and January. We've had almost 25,000 people die in the county, 24,444 deaths. And, it was hard. I had to hear every day how many people died, who was infected. And if you look at this black box, the rate of deaths and who it impacted, we see the rate for every 100,000 people, 211 people who died were African-American, 364 were Latino, and 124 were white. So a lot of difference. Going back to the left, today the rates are still high for people of color. For every 100,000 people who are still dying of COVID, the rates are higher amongst Blacks and Latinos, higher than they are with whites. So I celebrate the opening. I celebrate having been vaccinated and all of you who've had the opportunity to do that too, but we still have a lot of work to do. Again, this is something Dr. Pratt shared, that we have 86% of seniors vaccinated, and we have 67% of people over the age of 16 have gotten at least 1 dose. So we still have, that's 1 dose, we still have work to do. And then particularly looking at these rates by age group. When you look at the seniors, 65 to 79, it's almost 90% who've been vaccinated, which is fantastic because we know that a lot of seniors died and they have a lot of vulnerability and risk when they get infected to getting really sick and dying. But look at the 12 to 15. We're still at 30% there. So we have a lot of work to do for the younger age groups. And then again, if you look at it by ethnicity, you'll see that Latinos and African Americans have lower rates of vaccination than do whites. So we have the opportunity when we're out in the field to speak to those communities and let them know their risk. And also for all of us as we're enjoying the openness, the new openness of the county, that we would be cognizant and remember there's so many people who still need information and support and resources to get vaccinated. And this idea of not wanting to get vaccinated, of course, is not new. We had outbreaks of measles back in years before the pandemic, and the World Health Organization, which is the CDC for the world, considers it one of the top threats to the health on the planet, people opting not to be vaccinated. And so what does it mean to have confidence? It means that you trust in the vaccines themselves, who's giving them to you, and how they were developed. So those aren't easy things to have confidence in. And that's where all of our work comes in, to share information with people. There's a lot of issues having to do with access. People didn't, early on, all of this. It was, wow, that was horrible. There was no access to the internet, the time it took, whether you were eligible or not. No appointments, there weren't appointments at night if you worked. How were you going to get there? Being able to take time off work. Still, we see in surveys we've done that a lot of Latinos say, I can't afford to take a day off if I get sick. It's not possible. And then just this uncertainty about the cost and what documentation we needed, and then our immigration status. So a lot of access issues. And then things that impact our confidence and our trust, or negative experiences we've had in healthcare, worries about how it was made, things we've heard on social media, And so much information, it's very confusing. And the idea that it would be better just to get the COVID naturally than get immunized. We went from it's not your turn to now everyone go. And that was hard too, to make that transition to see like, we were all wanting to do it. And then now they're saying, come on, you got to go do it. So a lot of information, too much information, the wrong information, incorrect information, information that's hard to understand. And then generally, most of us in the world, if you put it on an arrow, most of us accept all vaccines. And then there's a small amount of us who refuse all of them. With the COVID vaccine, a lot of us were right in the middle. We were confident or we were waiting and seeing. So that's where a lot of people are sitting right now. They want the pandemic to end and be safe, but they're still nervous and have questions about the vaccine. And so when we're out talking to people, things that don't work, not listening to people, dismissing their concerns and say, oh, I think, the COVID vaccine is, going to make it that I never have a baby again. Oh, what are you talking about? So we don't want to dismiss somebody's fears or worries. The need we have once we learn about the vaccines and we believe in them, the need we have to correct people. Oh, that's wrong. No, you're totally wrong. Actually what is, that's a need I have all the time. I want to tell you, how you're wrong and I'm right. So just having to sit back and listen and be patient. Also, we can't assume what people do or don't know. So I think that a lot of people have gotten plenty of information about the vaccine, but that's not true. There hasn't been enough information that makes sense or is easy to understand circulating out there. And then assuming that it's just data and information will change their mind. If someone comes to you and they're worried, are they looking for information about the clinical trials? Are they looking for the newest journal article? Or are they looking for your support? Are they looking for someone to hear what they're worried about and give them some acknowledgement? Also, we don't want to give information to people they don't want. I always say you ask permission to tell people. They may not want to hear, and they might get really turned off if you just start pouring information. And then giving them too much information is something we don't want. Again, things that don't work: judging people, scaring people, threatening people, shaming people, telling them if they don't get vaccinated, they're doing the wrong thing. The rest of us are trying to get over the pandemic and they're keeping us from doing it. We also don't want to overpromise and say that the vaccine is going to fix everything. Dr. Pratt shared some of the concerns we've had. We heard about a few people having blood clots. We heard about this issue of potential heart inflammation. Don't overpromise, but when I share about the vaccine, the benefits of being vaccinated far outweigh any risk of the vaccine itself and far outweigh the risk of getting sick with COVID. And then don't tell everyone, let's hurry up and get back to normal. I just read again stories and saw really hard to see pictures of families who are grieving losses. There's so many people who passed away who are severely sick. And so it's not get back to normal for everyone. We want to get back to everyday activities, but there is a lot of death and suffering and illness, a job loss, all of that people are still processing. So our challenges, some people don't think children or adolescents need to be vaccinated. People are still concerned about the safety. There's fear of those side effects because it's new and they're waiting to see. But our strategies, and I always say this, that the messenger is just as important as the message, and you are the messenger. There's no perfect messages, but there are perfect messengers. People who people trust, who look to, who can provide information in a way that makes sense to people. We need to listen, we need to have respect, we need to, share information, not argue or dismiss, supporting people, being patient, and then again, providing support. So these 5 steps are things I know you probably do in your work all the time. I'm going to repeat them again. And when you're having that conversation with someone who's like, no way I'm getting it, I know the government's doing this and it's putting a chip and no way would I ever do that, go back to the list. So, sometimes I get really, when I'm out in the field and I'm talking to people and they're like, you're crazy, I would never do that. We know what you're trying to do. To step back and remember the steps, that I'm going to be respectful, that I'm going to ask them why they think that. I'm going to listen. I'm going to acknowledge their concerns. I'm going to share why I got vaccinated. And I'm going to resort to and use talking points that are easy to understand. And then be prepared to help people, if they're open to it, to find a vaccine. Someone saying no isn't a failure. People need time to make a decision. They heard it from you. Let yourself be that person they feel comfortable coming back to if they change their mind or want more information. If they're feel judged by you, that's not going to happen. So this is my list of things that we rely on when you need to take a deep breath. If you're getting frustrated, these are our key steps. So I always say we always need to assume that people are wanting to do what's best for themselves and their family and their children. They're attempting to make the best decisions they can. They're more afraid of the vaccine possibly than they are even getting sick. Again, we talked about that there's been a lot of loss. They may not be ready, and they may need help to find a vaccine. Asking open-ended questions, letting them share with you what their concerns or beliefs are, reflecting back to them what you've heard, acknowledging their concerns, and then again, checking in over time if you have the opportunity to see if they are ready to be immunized. So just checking in. Strategies that work, of course, people want to be acknowledged and not challenged. They want to return to everyday activities. They want to protect themselves and their communities, and they want to decide for themselves. So those are strategies we want to emphasize in our own communication and messaging. So many opportunities, if you've been immunized, to share your story and why you got vaccinated. Wanting to see parents, worrying about the safety of your family. So many things, having friends and family pass away or get really seriously sick from COVID. So share your story and let people know, yes, I was nervous and a good friend passed away and I knew that I had to do what I could to protect myself. So it's so much more impactful to hear a story than it is to hear data, right? So sharing your own personal experience, I think, is critical. And then having those key terms, not science, but just information, these basic things about the vaccine in your own words that you can share with people. And then helping people if they need it to find a vaccine. VaccinateLACounty.com has the list of all the different sites, including some they call pop-up sites. The website is available in Spanish. If you go to Vaccinate Los Angeles, you'll find the same website in Spanish. Again, be the person that people can come back to with their questions and check in over time if people are not ready. And then practice and share. I mean, you are just an incredible, I want to hear what you're doing already. So practice scenarios, hear from your colleagues what's working and what's not. Share challenging or successful experiences you've had. One thing I think is really great here is it says end with at least one action you can both agree on. So if someone is really hesitant, say what could be a next step possibly that they could feel comfortable with. And I know that, any interaction that you have, it always starts with a place of empathy. They know that you care and you're concerned. So coming up with the phrases and the wording that you think will work, your clients, they know you know each other. So sharing that information and practicing, I think, is really important and a great opportunity to keep improving the way we communicate about the vaccine. I also want to share that people can get Uber rides until July 4th. You can get a free Lyft or Uber ride to a vaccine site. There's the websites, and then you can call the DPH call center to get that arranged too. So that's pretty great till July 4th. And then we also have mobile services. So if there is someone who is homebound, can't get out and needs to get vaccinated, we have a mobile clinic that can come out and vaccinate you. There's also transit services for people who have disabilities and may need special transportation. So again, you can call our call center and get information to arrange that. There's incentive programs, you've heard about them. Some people have mixed opinions about getting incentives, gifts for being vaccinated. I like the fact that it brings awareness. Sometimes people aren't against vaccines, they're just not caring about them. They're kind of just like, what? And then they hear about a raffle and they're like, a raffle, I'm in. So I don't personally feel like we're bribing people or tricking them or anything like that. We're getting your attention to say vaccination is available and it's free. And so some people just don't care and they're like, oh, I can get, basketball tickets or Dodger. Yeah, count me in. So it creates awareness, and for some people it's the right incentive. It gets them, okay, I'm going to do this. So there's a link here that talks about some of the incentives that are happening at the state level. Know the requirements for youth, because I know you see families that have young people. So there's consent forms that are available. And also we've got to stay the course. Consider avoiding close contact indoors and crowded spaces. From my perspective, that may be something you may still want to do. We don't know who is vaccinated and who's not. Continue to wear a face covering in those places. Some of those places are still required, like public transportation, in the doctor's office. So I can share a link with Martha about exactly those places that were still required. There are cooties everywhere. Everything's been about COVID, but of course, flu and colds. Summer's here and the numbers are just a tiny fraction of what they were in the fall. But then comes fall and then comes winter, and we're going to have colds and we're going to have flu. We're worried about this variant creating an increase in cases. So washing your hands is just the way to go. And you may in the fall feel like wearing a face covering when there's a lot of people who are not maybe sick with COVID, but sick with a cold or a flu. When we're not sick with cold or flus, we keep our immune systems charged, so we have more protection against other infections. Back to my broken record. These are the 5 steps. We lead with empathy and respect. We ask people. We listen. We acknowledge. We share our own stories and experiences. We use our own words to communicate factual information, basic things about the vaccination, and then be prepared to share resources and help people. So that's my presentation. Thanks for your time. That's my email if you have questions. Thank you, and thank you for all the great work you're doing out in the community. We appreciate it so much.
Great. Thank you so much, Dr. Pratt and Aizita, for this amazing presentation. I think this was super informative. I saw people nodding and really engaged with the content. So I can't thank you enough for providing this for everybody. We do have a couple questions in the chat, so I'll bring those out, but I want to remind everybody to, first, if you have questions, feel free to put those in the chat. We'll bring them up to our presenters. And then second, we will make these slides available to you and the recording. So if there's something that you weren't quite familiar with, or you want to go back and look at it again, I'll send that out to everybody so that you can look at that again, share it with anybody else who might want to watch the recording, etc. So I'll get that out to everybody. But in the meantime, we'll make sure we have questions answered. We have thankfully a lot of time, so feel free to put anything you're wondering in the chat, and then I'll read out what's in there, and we can also have people unmute themselves and share as well. So I'll start with the first question from Diane. So I'll just read it to you both. It says, some people who have gotten infected with COVID-19 and their doctors, some people have gotten infected with COVID-19 and their doctors tell them different months that they will have immunity because of it. What do you tell these people who say that they don't need a vaccine because they have natural immunity?
Now that's, I'll take that question, and that's a very important question that has led to a fair amount of confusion and I think frustration. So the driving issue is we've seen people get reinfected with COVID. within 90 days of their first infection. And so we know that having COVID once does not guarantee protection against future infections. And we speculate, we think, well, the reason you got it again was the first time you had it, it wasn't real bad. So you didn't develop strong protection, because we've noticed that the sicker somebody is, the better their ongoing protection is. So if you get a mild case, or maybe you were, you thought you just had a cold or something, but it was COVID, which is one of the ways it can show up. So then within like that 91st day, you get reinfected. So that's what's driving the recommendation for at least one dose of vaccine after you've recovered from a COVID infection. Because we know some people can be susceptible still within just after 3 months. Very few before 3 months. They've happened, but they're super rare. But at the 90-day mark, we see the numbers of reinfections start to go up and be more noticeable. So that's what's going on there. And please get that, even if you had it, please get that first dose. There's a lot of discussion about whether you need a second dose. And that's an ongoing back and forth between the people who study viruses and stuff. But from our point of view as a public health entity, and with you as our, if you will, ambassadors, public health ambassadors for the community, that's the really the legitimate answer to what's going on, is people get reinfected again.
Diane, does that answer the question?
Thank you.
Okay.
Yeah. Well, actually, there's one more comment, because sometimes doctors tell them different things. Sometimes they tell them 2-3 months, and then some has told one of the people I know 6 months. So I don't even know if there's consensus on how many months the immunity may last. You want to comment on that?
No, Diane, that's like, again, that's one of the points of confusion and I think frustration for people. And the answer is, depending on who you talk to, you're going to hear different things. But right now, and this, as you can imagine, this disease, this whole pandemic thing is kind of taken over my professional world. There's no consensus yet on what the answer is, and there's no recommendation for a booster or when you might need a booster. So I've seen evidence, right? I've seen evidence for some protection that goes out years. And then we've seen other evidence that it's only 3 to 4 months. And what I think we're seeing, what I think the virus is trying to teach us is everybody's going to be different. And even how sick you get, or how sick you continue to be after you even just recover from the virus, but you still have the effects of the virus, right? Because the virus can still cause harm to your body that is ongoing, as Aizita mentioned, after the virus is long gone, but the damage is there and it's still hurting you and messing you up, right? So much of that is unknown right now. And it's frustrating for me because people say, Frank, I mean, I have close friends who know me all my life, and they ride me hard. Like, Frank, what's going on here? You guys are saying 15 different things, and they're working me hard. And we're having the same conversation, right? So that's what's going on. We don't have any recommendations yet. We're learning. And as soon as we know, we'll want to get it out so it's consistent and it's supported by good information that makes sense to people. I think that's another thing that might have gotten lost in the shuffle here a little bit. A lot of information is coming out. When you hear it, there's a little, it's like, as Aizita said, it's too much. And the way it's presented, it's not understandable. And I know myself, I've got to go back and reread and rework things several times. So I'm with you. But the answer is we don't know yet, but people are working super hard to figure it out. But in the meantime, please get that, at least that first dose after you've had COVID. So that buys you some amount of time yet to be determined.
This kind of came up from the conversation, but I'm wondering if either of you, I think particularly Aizita, but maybe both of you have ideas on this, how to have that conversation with families where the information is kind of one thing and then the next week it's something else came out and people are confused and not sure what the best recommendations are. How do you bridge that with the families that you're working with?
Thanks, Martha. Yeah, I think, I was saying at the beginning, the point is not to be an expert in vaccinations, and because the information is changing so fast.
Yeah.
But there are some key things we know. The vaccine provides tremendous protection against severe illness from COVID and death. That we know. That's not changing. That's for the moment. That's how it is. Also, we do know that the long-term effects of COVID are serious. And even for people who got mild illness, we're having some serious long-term effects from infection. There are knowns that remain about the what we're saying, I want to know the long-term effects of the vaccine. I don't have that for you, but here are my knowns. There's variants that are more transmissible now that may be make you more sick. And we have a vaccine that can protect you and your family from severe illness, from hospitalization and death. There are no vaccines, and Dr. Pratt can share this. We don't have, you think of all the millions of vaccines that have been given to children and adults in the last 75 years. And we just don't have any vaccine that's shown any serious long-term effects that are negative from being vaccinated. So what we do know is substantial about vaccines and the protection that the COVID vaccine can give us. And so the other things, we will stay tuned, and you can see the CDC and everyone is paying very close attention to anything that might indicate a negative impact from any of the vaccines, paying close attention to that. And so if there's one thing we've all had to tolerate is uncertainty. I wish we could tell everyone exactly the facts of everything right now, but we don't have them. So we have to make informed decisions and do what we think is individually what we think is best for ourselves, for our family, for our children, for our friends, for our community. Frank, do you have any other comments?
No, you said it well, Aizita. And just as an example of how all vaccines are monitored, a couple of decades ago, there was a vaccine that was put out to prevent a diarrheal disease in infants. Rotavirus is the virus. and a safety signal was picked up of this very uncommon problem with the gut, with the bowel. And it was just a slight bump up in the number of cases. They went back, reviewed everything, and the product was pulled off the market within days. And right now we have 4 safety systems monitoring all the COVID vaccines, in addition to all the other vaccines kind of continuously. Because there's this basic thing, and we're giving a substance, we're introducing a medicine to people who are really healthy. We're not treating something. So there's a really higher burden of doing the right thing there, because it's really, vaccines are an insurance policy. If you are the luckiest person on the planet and you're never going to be exposed or get any vaccine preventable disease, then you're a one in a gazillion person, right? And that might be you. But that's the insurance policy component, and it gives us a higher responsibility to make sure it's safe and it works. And we have 4 different safety systems ongoing right now, some that are very short term based on your smartphone app, to others that are much longer term, following the vaccines for months to years out. Yeah. And as you've seen, if something comes up, like there's a question with the young man in myocarditis, or the patients, mostly women between 18 and 50 who develop the blood clot thing, you saw how much attention it gets, and things, we shut it down until we get our arms around it. Yeah. Then make next decision.
I was going to say, Martha, I just had the experience of one of my nephews confessing to me, because he knows this is what I do for work, that he hasn't been vaccinated. He's 21 years old, he just graduated from college. And so, you know, I have all kinds of information for him, but in the end, my appeal to him was, I love you. I can't afford for you to get sick. I can't afford for you to die. I care about you so much. Please, you know, like, in the end, it wasn't like, well, you know, the most cases right now are amongst young people. The big peak right here is not older adults, it's younger people, because you guys are out and doing your thing. There's potential brain damage, lung damage, strokes, all kinds of things that are going to happen to your body. He's, you know, when you're young, you're like, whatever. But I was like, darn it, I love you. I care about you. I need you to be safe. I need you to be safe. Please do this for me. So he was like, okay, Nina, I'm gonna go. And he texted me the next day. We went online, we got on the phone, and we found the site. And I mean, I'm still emotional about it. When he texted me, I cried. I was like, oh my God, you know, if anything happened to that kid, it'd just break my heart. So it's an emotional appeal. It's an information appeal, and then just giving someone the support that they need. You know, I had to tell him, like, okay, well, okay, what's your zip code again? Let's go find the place. And so he's like, okay, I'm going to do it. And sometimes that's, you know, like if you're going to go on a zip line, someone's not going to, like, you're scared to do it. You don't need the data on how many people have safely zip lined. You need to say someone who's like, I know it's scary, but do it. You're going to be okay. I did it. I'm okay. And they're like, okay, here I go. All of us were doing something new. We've all been under tremendous stress, a lot of uncertainty, and we need each other's encouragement, because there is uncertainty. You know, Diane was asking good questions, like there is just so much uncertainty, but this is something we do know. The protection we're going to get from the vaccine is tremendous. And so we have to keep supporting each other and acknowledge, like, we're nervous. Doesn't make us bad, doesn't make us against vaccines. Just like, we're nervous, that's normal. We're questioning people, it's okay.
Thank you for sharing that. I think that was really important, and I saw a lot of people nodding, but that's, I think, a big strategy we've heard from people who've been successful. And this is true. I know everybody here is a home visitor or home visiting supervisor. You know how sometimes the families need someone to sit down with them and just call with them. You know, here's the information. I'll sit here and let's call them together, or let's work together to sign you up. And I'm sure we've all had a lot of success with that, with other things too. So I think that's a huge reminder of sometimes they just need someone to help them out and encourage them, and then be there while they make the appointment and support them through that. So that's really helpful. Thank you.
And I was going to say too, Martha, all the stress we've been under in this last year, they're like, I can't do one more thing. I can't take one more risk. I felt so vulnerable and scared for the last, year. I can't do one more thing. I can't extend myself and try something new. So just hearing why people are nervous, I mean, they're just like, people are at their brink. You know, if they've lost someone, if someone's died, if someone's been sick or they've been sick, they're like, oh, I want it. If they perceive the vaccine as a risk, risks are not what they feel like taking. So we have to share with people that the risk is far outweighed by benefits of being protected.
Thank you. That's great. That's another really important piece. So thank you. We have one more question that we didn't get to in the chat, so I want to bring it up quickly before we run out of our time with you. The question is about the COVID vaccine and infertility. So the question is there a reason that the COVID vaccine has been associated with infertility? So wondering if you could speak on that.
The fundamental answer to the question is it's fake news. There's been no relationship between infertility or the vaccines, even remotely seen or defined. Yeah. No.
I was going to add too, Frank, it's like, not only is it completely false news, we see that there is potentially some benefit to the pregnancy and to the baby of mom having immunity. So it's like, no, it's for a lot of vaccinations, babies get the immunity from their mothers, which is fantastic. And then something behind that, though, is there is a history in this country of women of color being sterilized against without their consent by the government. And if you're in a community where that's happened, then you are much more likely to feel like there is a potential for the government to take some action against you like that again. So there is something behind, the feeling behind it is real, and we have to acknowledge that distrust and that fear and that trauma. And again, helping people process that, acknowledging that, and then also saying, so we need to protect ourselves. We're having another attack on our communities with this disease. And so we need to do everything we can to protect pregnant women and families from COVID.
Yeah, I had this discussion with my daughter-in-law. You know, now I've got a brand new granddaughter who's 5 weeks old. So we had this dialogue, and it was a give and take. It was a dialogue. It wasn't anything heavy-handed. It was like a dialogue because people ask a lot of smart questions, and you have to acknowledge where they're coming from. And she was coming from the too fast perspective. That was Annie's perspective. So yeah, totally relate to that.
I put in the chat a link to a webinar we had about really in depth a couple weeks ago about the COVID vaccine and pregnancy and lactation. So if people have future questions or additional information, because as Aizita said, information is something, if we have all the information, then we can learn how to present that to people in a way that makes sense. So feel free to watch that. I also think an important piece to pull out of that, which was highlighted in that webinar too, is these families who are asking and concerned about infertility, they care about their children and their health of their children. And so it's coming from that place, right? We're coming from the place of, I'm trying to protect my child, I'm trying to protect my family, I'm trying to protect myself. And if you can help them understand the best way they can do that is through the vaccine, then I think you're really answering and serving them. You're answering that question and coming from a place that they are looking for. So more on that in that webinar if you have more information, but I think that's, or if you want more information on that, but I think that's a really helpful perspective to take. Okay, any final questions for Dr. Pratt or Aizita? We have such a wealth of knowledge in the room, so I want to make sure everybody gets their questions answered. And like I said, we'll make the recording available. We'll send out the slides and both of their email addresses. We can share if that's okay with them. And so if you do have questions, you can follow up directly. But any final thoughts or questions anybody would like to ask?
Did we adequately ask the question, do we need to vaccinate every year? Did we cover that okay? The answer is we don't know quite yet. It's certainly a possibility, but we're just not sure how long vaccine protection lasts right now. Some vaccines are once a year, some are every 5 years, and some are once in a lifetime. So it's the full range of responses. And as soon as we know more, then those decisions can be made and we can make recommendations. Yeah, right now it's an unknown.
Okay, saw a thumbs up. So great. Thank you both so much for providing this and for the support you're giving to the community. We so appreciate having you here. So, and thank you to everybody who was able to participate. I hope you learned something. I know I don't think you could have not learned something from this. So please take that knowledge and spread it among your coworkers, your staff, and the community. So thank you both so much.
Thank you, Martha. Thanks.
Thank you. Thanks very much. Take
Right.
care.
Be well.
Nice. Have a nice rest of your week. Thanks, everybody.
Yeah, everybody. Bye-bye.